Welcome to the Explainer. Today, we're unpacking a really rare and complex neurological disorder, and we're going to do it by following a single, totally baffling case, a medical mystery that left doctors scratching their heads and pointed to a culprit that, honestly, no one saw coming. All right, so picture this. It all kicks off with a truly terrifying medical emergency. We've got a seemingly healthy 29-year-old guy, right? He's had some mild back pain, a little fatigue, but nothing major. And then all of a sudden, his legs just start giving out. The weakness gets worse fast. Within just 72 hours, he's basically paralyzed from the waist down. He rushes to the hospital, obviously desperate for answers. So, what in the world was happening inside his spinal cord? The medical team, they rush him into an MRI, and the first scans, they show this massive lesion inside his cord. But this wasn't the aha moment they were hoping for. In fact, it was just a clue that made the whole mystery even deeper. Something was attacking him from the inside, causing this catastrophic damage, and they had to figure out what it was, and fast. Okay, so to really get what the doctors were facing, we've got to look at the anatomy of this attack. It all starts with a diagnosis they suspected, a really rare and devastating condition called spinal arachnoiditis. So what is spinal arachnoiditis? Well, you have these delicate membranes that protect your spinal cord, and one is called the arachnoid. Normally, it's like a fine web-like layer, but with this condition, it gets super inflamed. The best way to think of it is like scar tissue forming inside your spinal canal. It starts clumping nerves together, squeezing them, and basically choking off all those vital functions. Now, this is what makes this disease so tricky. Look at all the different things that can trigger it. This isn't a disease with just one cause. It could be from a physical injury, like from a car accident or a surgery that went wrong. It could be a nasty infection, bacterial, fungal, you name it. It could even be a weird reaction to an injection in your spine. With so many possibilities, you can see why trying to nail down the root cause is just incredibly difficult. And this right here, this shows you the core problem perfectly. On one side, you've got a healthy spinal canal. The fluid, that's the cerebral spinal fluid, or CSF, it's flowing freely, the nerves are all separate and happy. But on the other side, with arachnoiditis, it's a mess. That inflammation creates these sticky webs of scar tissue. The nerves get all tangled and compressed, the CSF can't flow, and that leads to horrible pain and loss of function. The whole space just becomes this tangled, inflamed trap.
So, when that fluid gets blocked, where does all that pressure go? Well, it can lead to something even worse, a secondary condition called syringomyelia. Basically, a fluid-filled cyst, it's called a syrinx, starts to form inside the spinal cord itself. It just expands like a balloon, stretching and destroying that delicate nerve tissue from the inside out. And this is exactly what the MRI showed in our patient. A massive syrinx stretching his spinal cord almost the whole way down, from his upper back at T3 all the way to his lower back, L1. Just unbelievable.
Okay, so now we get to the real puzzle. The doctors knew what was happening, right? They had a name for it, arachnoiditis causing a giant syrinx, but they had absolutely no idea why. And this is where the story really turns into a proper medical mystery. Just look at this timeline. It really shows you how explosive this all was. For months, it's just this slow burn, mild back pain, feeling tired. Then, boom. In just 3 days, it ignites into a full-blown crisis. With the patient's condition getting worse by the hour, the medical team knew they had to act, and act fast. They scheduled a really high-stakes surgery to try and relieve the pressure. And this is key, to get a biopsy of that inflamed tissue. So while they're prepping for surgery, the investigators are doing their thing. They're running down the list of usual suspects. They test for all the common infections that cause this kind of thing, tuberculosis, syphilis, brucellosis. Nope, all negative. They looked for a tumor, nothing there. And the guy had no history of spinal trauma or surgery, nothing that could explain it. Every single lead just hit a dead end. And then, the biopsy results came in. And what they found was the crucial piece of the puzzle. After all those dead ends, the lab culture delivered a result that was so shocking, it just changed everything. Get this. The culprit wasn't some aggressive, rare superbug. It was Staphylococcus coni, a common bacteria that literally lives on the skin of millions of us completely harmlessly. This was the first time, ever, that this microbe had been documented causing this disease. The mystery wasn't just solved, it was blown wide open by a suspect hiding in plain sight. So, with this completely unlikely culprit finally identified, the whole game changed.
The path to recover was suddenly clearer. Now the medical team could launch a really targeted counterattack, combining some pretty sophisticated surgery with the right medicine to fight back.
As you can see here, there's no one-size-fits-all cure for spinal arachnoiditis. There's no single magic bullet. Treatment has to be super personalized, and it's usually a multi-pronged attack. You've got drugs for the pain and inflammation, surgery to physically relieve the pressure, and then, of course, long-term rehab. And for our patient, the solution was this really smart 3-part plan. First, the surgeons put in a shunt. It's basically a tiny tube to drain that fluid-filled cyst and get that internal pressure down. Second, they did what's called a duroplasty, where they actually rebuilt the scarred outer membrane to give the spinal cord more space. And finally, the breakthrough part. Knowing what bacteria they were fighting, they gave him a 6-week course of targeted IV antibiotics to wipe out that Escherichia infection for good. And the results? Honestly, they were remarkable. 1 year later, they did another MRI, and the syrinx had shrunk dramatically. Now, it wasn't a 100% full recovery, but his muscle power came back to a 4 out of 5 in his hips and knees. I mean, that is a huge improvement. It was enough for him to go back to living a completely independent life. Just incredible. But, this single extraordinary case is so much more than just one patient's story. It's the perfect example of why we need a global, data-driven approach to rare diseases like this. It makes you wonder, right? How many other cases like this are out there? And what can we learn if we put all that information together? So somebody actually did the research. A recent study looked at all the publications on spinal arachnoiditis to see who's doing the work. And it's pretty clear. The United States is way out in front, followed by countries like India and Japan. What this tells us is that while there's growing interest around the world, the expertise is really concentrated in just a few key places. And that leads to a really critical point. What the data also shows is that while individual research teams are making progress, they're not collaborating with each other as much as they could be. The next big breakthrough in treating SSA, it's probably going to come from breaking down those silos and getting researchers to share their knowledge, their case studies, and their data across borders.
And this chart really shows us where all that effort should be focused. 1/4 of future research is aimed at finding new therapies. Another big chunk is about understanding the disease itself better and developing personalized medicine. Exactly the kind of customized approach that saved our patient. It's all about getting smarter and more targeted.
So the story of this 29-year-old man and the common skin bacteria that almost took away his ability to walk, it's just such a powerful reminder. It proves that even in the rarest, most mysterious cases, we can find answers. It leaves us with this huge question and a real sense of hope. For a disease that was once seen as a life sentence, what incredible new breakthroughs are we going to unlock next, especially if we all start working together?